Welcome back to another episode of the Skinfluence Podcast. I'm your host, Dr. Dustin Portella, joined as always by my co-host, Austin.
I'm Austin Lee, physician assistant, and happy to talk about what we see in clinic every day.
We know that there is thankfully a resurgence of people getting into fitness. There's boutique fitness studios popping up. People are taking more supplements than ever before, peptides, even some questionable black market stuff. And how your workouts can trigger acne is kind of what we're talking about today. And certain behaviors that otherwise are healthy for you are sometimes making trouble for your skin.
Yeah. And, we're seeing a big push in our culture to be more health conscious, to be doing things that help improve the way we feel in our bodies. And sometimes it can have a little bit of a negative effect on our skin, the things that we do, especially when it comes to friction, gyms, sweat, and all the above. So let's get into what we're talking about, which is something called acne mechanica.
Yeah. So acne mechanica is a term that was coined by the dermatology community at some point in the past that alludes to acne that is the result of friction, of contact, of something in contact with the skin. And there's a few classic conditions in which we see it. The one we, learned about in residency was the chin strap for football players on their helmet, or wrestlers who wear the headgear because it rubs and they're often not cleaning it appropriately, and they get acne in these areas that are constantly occluded by protective equipment.
Yeah. Another one we see is it's very common on the back, and so we see it with football pads on the back. If you're working out and you're staying in the gym for a long period of time and you're just drenched in sweat and you're on bench, you're sitting on hard surfaces, that type of area can also happen. But anywhere where you have sweat and friction is where we see this type of acne.
And then people are wearing like tight-fitting clothing in the gym, particularly women. It's kind of the trend right now. And even some men wearing compression shorts underneath their shorts. I've had people texting me photos of folliculitis, of acne-type bumps that they're getting on their thighs from those kinds of clothing. And so it's kind of the thing that we see more as people try to be more health conscious, that your skin doesn't always like some of the changes that you make.
Yeah. And sometimes it's part of your job. I see police officers very often who have acne on their back because they're in vests and they're outside and they're hot and they're sweating. There's not much they can do about it. So yeah, this is something that affects a lot of people.
That's a good call out, because in residency, I once had to write a letter for a patient who was a police officer. They were getting terrible acne across their chest and their back from wearing a bulletproof vest. And part of it was that through the constant heat and the sweat, the vest was breaking down, and the fibers that made it bulletproof were actually starting to poke his skin.
Oh, really?
And he could feel it like pinching him, and he wanted a new vest, but the department policy was you can only get a new vest every 3 years, and he was like a year early.
Oh.
And so I had to write documentation to support that, yes, he has a medical condition induced by the vest, and this medical condition would likely improve if he got a new vest that was better fitting for him.
Interesting.
Yeah.
Dang. I wonder if they get shot in the vest, do they get a new one?
I would imagine that they would
so.
give them a new one. My cousin was a police officer, and he got shot while on duty, his vest saved his life. So
that's got to be the scariest thing.
But when he retired, he got that vest back. It was weird because the department didn't like his department, leader, who I don't know what the title is called, the chief. I don't think he got along with him real well, and he didn't want to give it to him.
Oh, really?
Yeah, but he did end up getting it when he retired, and he's got it framed in his house that it saved his life.
Yeah.
Just kind of an interesting little story.
That is an interesting story. Yeah. Scary story, though.
Another thing is that we see the influencer culture, both men and women in the gym, and there's this whole genre of people filming themselves in the gym and the controversy that is, but they are getting all dolled up before going into the gym. Their hair is perfect, their makeup is perfect, and sometimes all of that product, when you put it on, whether it's hair products like pomade or lots of makeup, you're putting yourself in a situation to also get acne.
Yeah, it can trap moisture underneath the makeup if you put enough or more occlusive type makeups on. So, yeah, there's lots of ways to get this type of acne, but there's other things that can cause it besides what we've talked about. And some of those products are supplements.
So there's some data, and as time goes on, I think the data is a little weaker, but whey protein can stimulate IGF-1, insulin-like growth factor 1, to be raised a little bit, and that can lead to some androgenic effects, increasing the likelihood of acne. And so when I see patients, particularly men who are in their 20s, 30s, 40s, that are coming in with new onset acne, or teenage boys who are athletic, I will ask them if they're taking whey protein.
Yeah.
And particularly for the men, I'll ask them if they're on gear, which is kind of the code word for like, are you taking testosterone? Are you taking anabolic steroids otherwise? Because these things are easier to obtain than ever before.
Right.
And there's so many gray market and black market sources. I had a patient not terribly long ago who was a teenager who was buying stuff off a website while they were lifting weights. And I mean, particularly dangerous. And then buying Accutane to manage the acne that they were getting.
The fact he was able to get Accutane.
Yeah, just buying it right off of a website with no physician supervision. Thankfully, they were coming in to get Accutane the right way and have that managed and labs monitored and all of that. But so there's a lot of different supplements, pharmaceutical injections that people are using that might also lead to acne.
Yeah. I definitely have seen cases where I've had a few patients, women, who were getting B12 injections at urgent cares and things like that were being offered for energy, but it was eliciting inflammation and especially acne. And they were getting kind of the cystic, deep, painful type of acne. And initially when I started talking to them and treating them, I didn't have any idea that's what they were doing. They weren't giving me that information.
Yeah.
And it came out of eventually where I said, have you changed birth control? What's different? Because this is coming very regimented. It's coming in a very cyclical time frame. And they're like, it's not around my period. And then we discovered that they were getting B12 injections.
Just high doses of B12.
High doses of B12. They felt great, but it was just, what would you like more?
Trade-off?
What's the trade-off? So
I've also seen people who are trying to manage hair loss on their own start taking high doses of biotin and then also getting acne from that. Not necessarily related to workouts like we're talking about today, but high doses of biotin, 1, have not really been shown to help promote better hair growth.
Yep.
And 2, at high doses, they can cause acne in certain people.
Yeah. Yep. It's interesting because a lot of times we think more is better.
Yeah.
And that's not the case for the most part. It's not the case. So if you feel like taking a little bit of biotin or a little bit of something's going to help, taking more is just going to yield more side effects typically.
Another thing that sometimes happens is people are going to the gym in the morning before work and they'll shower at the gym. And if you're not bringing your own like shampoo and cleanser, at least most of the gyms that I've been in, they have just a soap dispenser on the wall in the shower, and they're using that to wash their hair, wash their face, wash their body, and it's just hand soap. Yeah. And it's stripping the barrier, it's not kind to the skin, and that may also make acne worse. So they're overwashing and trying to scrub the acne away with a soap that is over drying the skin.
Yeah. And if they're taking pre-workout before they work out, that's not going to help at all sometimes, because there's often vitamins and niacin and things like that that's going to cause some flushing, elicit some inflammation in the skin. So there's a lot of things that can happen before the day really starts that can lead to acne mechanica.
So just because something is good for your overall health doesn't mean your skin's going to react positively to it. So we're going to get into all of the things that you can do to kind of prevent that. But before we get into that, we're going to talk about a little did you know.
So my did you know comes from where did we start seeing acne mechanica? And it was with soldiers who were wearing their uniforms, sweating a lot, and they were getting these flares of pimply bumps. And that's when we started documenting and researching and trying to understand acne mechanica a little bit better.
That's where the term comes from, huh? It was from soldiers first.
From soldiers.
Yeah, interesting.
Yeah.
Another condition that is common in athletes, I don't know about common, but it was coined for athletes, is something called herpes gladiatorum.
Which is a great name.
It's a great name because it makes you sound macho and masculine and all these things. But it's what we commonly see in wrestlers, because wrestlers, or now with the popularity of Brazilian Jiu-Jitsu, so many men now and women are on the mats, and if the place is not cleaning those mats appropriately and somebody comes in with a fungal infection or with a herpes infection active on the skin, that gets onto the mats, and then you go roll over the top of that and you can pick it up. So herpes gladiatorum is when you get a herpes outbreak on the body because it got introduced to you from being on the mats.
Yes.
And we see this weird distribution that in some cases might look like shingles, but we test it, and instead of being shingles, it's herpes simplex instead of varicella zoster, they're two viruses in the same family, but they are different viruses. And when we culture it out, we're like, oh, this is herpes. That's weird. Are you a wrestler? Do you do jujitsu? Then it kind of comes out, and you get these herpes outbreaks. And once you got herpes, it's going to travel into the dorsal root ganglia of the nerves, and it's going to live inside you forever. And it can break out anytime in the future, which really is unfortunate.
Yeah. And it's always a sad conversation because they think, is this the STD or STI? And you could explain, no, it's not that. But you got
it's the same virus.
It's the same virus.
But you got it through other activities. Yep. Which sucks if you get it from drinking out of somebody else's cup or
totally.
Rolling around on the mats because you're doing something that's healthy for you. So herpes gladiatorum. It's been a while since I've diagnosed it.
Yeah, it's been a minute for me too.
So as we come back, you are wanting to work out, you're doing the right things to take care of your body, you're eating well, but you're getting acne. So we're going to walk through some of the things that we recommend as dermatologists to help protect the skin or to treat acne, to keep it from popping up in the first place. And so any particular advice you want to start with?
Yeah, well, we'll start with what you mentioned earlier on in this episode, where high school kids who are playing football, or adults, and are using that chin strap, and you get that chin strap type acne. One of the things that I always talk about is I say carry benzoyl peroxide wipes or hypochlorous acid or something to clean out the chin strap. Yeah. So that way, when sweat inevitably pools up in there, it's not going to elicit acne. It's not a perfect treatment. You're still going to have friction. You're still going to have the chin strap, but it definitely helps. You
got to wash the pads, the equipment as often as possible. Hockey players are notorious for this.
Oh, yeah.
But I think the hypochlorous acid is a good option because it's just a spray. You can keep it in your gym bag and spritz down the equipment after every practice, after every game. So you're not necessarily doing a deep clean every time, but something that will help to kill some of the bacteria.
Yeah, and it's pretty gentle on the skin typically.
And then if you are going to the gym, particularly in the morning or after work, and then you're not showering right after, bring your own skincare.
Yep.
That's another thing you can do. If you don't shower right after working out, the hypochlorous acid spray, AHA, BHA wipe, like our glycolic toning pads that we carry here in the office, those would be good things just to clean the skin a little bit.
Yeah.
At the very least, a makeup removing wipe, something like what Neutrogena makes, just to get some of the sweat, the oil, the dirt off of your skin so it's not sitting there for a couple hours before you can get into the shower or wash your face.
Totally. As someone who I play pickleball often before work, I shower at the facility, and I have to lug around all my skincare and I bring sunscreen and I put it on while I'm there, and it's definitely helpful. It's a good way to start because sometimes you can't make it home, you can't have your routine at home, but having things that you can bring with you to help protect your skin, especially after you're sweating a lot, working out, that type of thing is always
just
a good
get
choice.
Travel sizes. I mean, if you're that into it, you're probably meal prepping, you're taking your meals with you. Just like throw some skincare in your bag.
Yep.
Take it with you to the gym.
It's not big.
Yeah.
It's not a lot. So what are some things that you can do during the workout or while you're at the gym to help take care of your skin while you're there?
So you cannot count that everybody else is going to wipe down their equipment.
Oh, yeah.
And so I'm an advocate for wiping down the equipment before you use it and after. And
Smart.
Even the people that I've seen, and I'm probably guilty of this myself sometimes, is you use a piece of equipment and you just grab the towel from the dispenser and you just give it a quick swipe. That doesn't mean that you're cleaning it well. Mm-hmm. And so making sure that it's clean. You can also carry your own towel around the gym. You can set it on the equipment, and so that you have a barrier between you and the bench or the equipment, whatever you happen to be using.
Yeah.
And that could help. If you're particularly prone to getting acne from the gym, that's probably a step that you should take. It's not necessarily something that everybody has to do, but it could be helpful if you're particularly prone.
Yeah. And then if you're lifting weights or using dumbbells, try to avoid touching your face afterwards. I have definitely been prone to, in between sets, I'll sit up on the bench and I'll just put my hand and I'll just kind of sit there or put my heads in my hand and just try to focus and try to be in the moment. And not the best idea when you're touching dumbbells that maybe haven't been cleaning a little bit.
Yeah.
So if you're cleaning them before, great. But if you're sitting there and you're putting pressure or touching your face when you're all sweaty, you're just leading to that sweat grime pushing into your skin and your pores, and it's going to lead to acne.
That's a good idea to be hands off, because even if they are getting cleaned well, the chemicals in those wipes can be pretty harsh on the skin, and you can start to break down the barrier and cause irritation that might also lead to acne.
What are some of your favorite cleansers to use after you exercise?
When I get all sweaty, I like to use a salicylic acid-based cleanser. I just feel like it does a good job removing extra oil and sweat from my face. It's not something that I use, every night before I go to bed, but after a workout, particularly outside when I've been wearing sunscreen, I really like the clean that gives me.
Yeah.
And so a medicated cleanser can be helpful in those circumstances. Something that will also kill some bacteria, like a benzoyl peroxide, can be helpful.
Yeah. I find that for my back, if I'm working out a lot or if I'm exercising frequently, like 4 or 5 times a week, my back will start to break out a little bit. And benzoyl peroxide, like a panoxyl, has worked really well for my back. It's a little too harsh for my face. I get too dry, so I use a salicylic acid cleanser as well. But yeah, those are kind of my two go-tos, is using benzoyl peroxide or a salicylic acid as well.
And hypochlorous acid spray is another thing that you can do. Even after you step out of the shower, you've used an acne cleanser, spritz down with that on your face. It's pretty gentle, kills bacteria. So
another thing that I like to do, because I'll be vulnerable here, when I sweat, I don't smell good.
Yeah.
Some people smell fine. I don't. And so I'll use Hibiclens on occasion to clean out kind of like those, like my armpits and areas that tend to smell a little bit bad. It just kind of helps keep that body odor under control, and then I'll put deodorant on. But
that's a good tip. Another factor that can make a difference in whether you develop acne or not is how quickly you can clean off after your workout.
Totally.
So some people don't like to shower at the gym, and especially if you do, wear some sandals so you don't pick up toenail fungus from the public gym.
Shower shoes are cheap.
Yeah, they're cheap. You should be using them. But the quicker that you can shower and clean your skin and then apply products, the better you're going to be. If you're driving to the office, if you're heading back home, try to get showered as quick as you can there. And if you can, if it's going to be a while, you're going to run some errands first. That's where some of the other products like the hypochlorous acid spray, glycolic, toning pads, makeup removing wipes, those can come in handy in those circumstances.
Yep. And I like benzoyl peroxide wipes as well. They're harder to find sometimes, but they can be beneficial. It's always, I am the type of person where I'll take 3 showers a day if I have to. And it's always interesting when I have a patient or two come in, they're like, I just came from the gym. And no disrespect, I mean, we're all busy, and I appreciate people trying to find that in, but I just could not do that. I cannot go exercise and then go do stuff without showering. That's just, could you, are you the, I'm a serial cleanser, I guess.
It kind of depends. It's just how the day is going. And sometimes I'm just busy. And if I intentionally work out, usually I will shower. But if I'm getting sweaty because I'm outside playing with my kids or doing yard work, I'm not going to shower before I run to Home Depot and pick up stuff, for the project.
I'll agree with you there. I'm in the same way. But I think it just goes back to my BO.
Some like middle school trauma coming up there.
I think so.
Kids made fun of you.
I got to shower. Well, other areas where you can pick up a lot or some bacteria or there are environments where bacteria can grow and affect our bodies, causing inflammation, pimples, things like that, are saunas and steam rooms. Yeah,
you do have to be careful if it's a public area. Again, that's where I'd wear some shower shoes in there.
100%, yeah.
But overall, I do think steam rooms and saunas can be helpful for your skin. So I encourage people to use them if you have the time to do it. There's a lot of benefits from that, and particularly infrared sauna, if it also includes red light, can be really healthy for your skin, anti-inflammatory. increasing the vasodilation, getting better perfusion of your skin. So there's pros and cons to using that. Overall, I'm very much in favor of particularly saunas.
Yeah, I love the way I feel after a sauna. I can't spend too much time. I get lightheaded quickly, but but I love saunas. Steam rooms are okay. If they have a little eucalyptus in there, opens up the sinuses. But
yeah, I struggle in steam rooms more. I don't know. I just can't breathe as well in them. But a good dry sauna, 25 minutes, I can
no kidding,
sweat it out. Yeah, but I've had to build up my tolerance.
Yeah, I would have to build up to 25. 10 minutes and I'm like, whoa, I need to take a break.
Along with this, we talked about it earlier, but if you are frequently going to a gym, you're maybe prepping for a competition or you're trying to keep up with the next person that's bigger or stronger, avoid that temptation to get on black market gear.
Yeah, totally.
These types of things that are often unregulated, and we have surge of peptides becoming very popular now. And some of the peptides are very good. They have a physiologic mechanism that can help with muscle growth and tissue recovery. But if you're getting them from a website in the gray market, black market area, you don't know for sure that you're getting a product that's sterile, that's pure,
that's exactly
that
right,
is biologically active. You don't know the dosing. So there's a number of peptides that are classified from the FDA in a way that compounding pharmacies can work with them. Get that prescription from a doctor, do it under medical supervision.
Totally.
And that way, if you do start to experience a complication like acne, then you can have that managed. You can adjust the dose. You can talk to a provider about that. So that's just something to be cautious with, because I've seen many, particularly men, but a few women, who are getting on gear that wasn't properly prescribed, and they're coming in with acne and other skin problems.
100%. And all of this is becoming more and more mainstream and popular, so it's not hard to find a physician who is okay and comfortable prescribing this in a safe way, titrating you up and working and helping to do it in a safe way. But yeah, when you're getting stuff off of the gray or black market, you don't know really what is in there, and because they're not beholden to any government body or any body to report this is exactly how it works.
They may not be going through inspections or anything to guarantee safety, purity standards, anything like that.
Yeah.
So if you're doing these things, you're not wearing the tight-fitting clothes, you're washing right after your workouts, but you're still having trouble with acne, when would you recommend going to see a derm provider?
My recommendation would be, if you're struggling with acne, you've tried some over-the-counter things and it's just not helping, or it's getting worse, definitely come in, and there's plenty. We have a whole toolbox of things that we can do to help mitigate this, talk you through how to, what should you do during your workouts, after your workouts, just like we talked about today. And then there are prescriptions that we can send in. If it's really deep or cystic, you can do doxycycline. Topical clindamycin can be beneficial. And then we have a whole host of over-the-counter products that we could recommend to guide you through that.
Yeah. In some cases, I've had to put guys on Accutane who, they're on gear. Generally, even testosterone just prescribed by their physician, but they're getting acne. And so there's a lot of tools. We want to help you continue to stay healthy, but also keep your skin happy. And if you are getting acne and you're at risk of scarring, they're particularly painful, don't hesitate. I wouldn't even mess around with over-the-counter stuff.
Totally.
If you're at risk of scarring or you're getting a lot of pain from the acne, come and see us sooner rather than later.
Yeah, I would agree with that, because we can prevent scarring, we can get rid of this, and we can help you live your life without having to worry about it.
Before we wrap up today, we want to introduce our product of the week, which we've talked about before. It is the MANTL Skincare Set. Prices are better than ever on this right now, so we have lowered the price. As our inventory has started to go down, we're ready to get rid of all of it. So right now, the sunscreen is down to $10. It used to be $15. 2 of them for $15 now. And you can get the whole set for $30. So we're going to have a link to that in the podcast show notes and on the YouTube video description. It comes with a cleanser. It is a really good cleanser. It's a good size cleanser. An age-defying moisturizer, so it has light exfoliation, and then the gel invisible sunscreen, so it's not going to clunk up in facial hair. It's not going to give you a white cast. It's safe on all skin tones and is SPF 30. So some of my favorite products to recommend and that I use personally, and so check those out in the podcast show notes.
And it has been flying off the shelves because of the price point, so inventory is limited.
So thank you for joining us on this episode of Skinfluence. We want you to stay healthy and we want your skin to be happy. Share this episode with a friend if you've found it helpful, and leave us a 5-star review wherever you listen to podcasts. I'm Dr. Dustin. You can find me on all social media platforms at Dr. Dustin Portilla.
And you can find me on most social media platforms at Austin Lee PAC.